So this is a second post that I'm going to do on the Th1, Th2 systems and how that relates out to autoimmune diseases. So last time we talked a little bit about people who have autoimmune disease have an overactivity of the Th2 system. And so what can you do to calm down that Th2 system? Because that's really a major part of treating and preventing an autoimmune disease, is keeping that Th2 system down. So how do you diagnose if your Th2 system is overregulated? And the answer is there isn't any clinical way to do this. You can do this in research centers, but for doctors out here like me on the main line, there's no simple test you can run down and get to find out if your Th system is over ramping. You can get a clue to this. If you got an autoimmune disease, I pretty much promise you that's what's going on. The other clue is if your doctor does various various antibody studies, and you see that you got a lot of antibodies to all kinds of different things, that's another clue that your Th2 system is being upregulated. And it's part of the problem here, because it's going to make those antibodies, and those are the antibodies that are going to cause your autoimmunity. So if you're plagued with allergies, there's a really good chance you have a Th2 imbalance. In any of those conditions, the treatment's going to be the same. Primary treatment is to, one, avoid anything that stimulates the Th2 system. The following factors are known to stimulate Th2 system, so stay away from these factors. The most obvious Th2 systems are vaccines. Yes, vaccines. What vaccines? Any vaccine. Literally, the definition of a vaccine, if you've been watching the news, you know this. The definition of a vaccine is it's a substance that stimulates the Th2 system to make antibodies. That is the definition of it. So all vaccines, all of them, 100%, are contraindicated if you have an autoimmune disease. And in my mind, I don't like vaccines anyway. And you got to be very careful if you got a family. For me, if you have a first-degree family member, that would be a parent or a sibling with autoimmune disease, I don't want you having any vaccines, because you're at a greater risk of developing an autoimmune disease, and that could be the thing that pushes you over. But that's not the only problem that can rev up the Th2 system. Intestinal parasites can do this, and I'm going to talk in a further post about intestinal parasites. And you can have intestinal parasites, folks, and have absolutely no intestinal symptoms. So just kind of keep that in mind. Another cause could be mold. Mold exposure is pretty common these days, and if you've been exposed even 10 years ago to mold, the possibility is you have a lot of antibodies to that mold, and it's stimulating that Th2 system. So you can talk to your doctor, you can have an antibody study done on various molds, and to see if you have that. If you happen to have antibodies to molds, and you live in a house with mold, or you work in a work environment with mold, and you have an autoimmune disease, you will never get better until you get rid of that exposure. So you have to get rid of the mold in your house and or get rid of the mold in your work environment, or you're just not going to get better, because it's going to constantly be stimulating your Th2 system. And the last thing I want to talk about is chronic infections. And what I mean by that is you get exposed to a virus. Now, you could control a virus if your Th1 system is operative. It'll control the virus. But if your Th2 system is the operative system, you won't be able to control the virus, and you'll get into what we call a chronic viral illness. And all that does is make all these antibodies that upregulate the Th2 system and downregulate the Th1 system, and you're stuck in this no man's land where you're just not going to get better until you get rid of that chronic infection. So how do you get rid of the chronic infection? Ozone therapy is the best way to do this. And if you don't know much about ozone therapy, it's a form of highly purified oxygen that very powerfully controls infections, especially these chronic viral infections. I wrote a book called The Ozone Miracle. You can access that through Amazon. So if you are battling with a chronic viral infection and an autoimmune disease, or just chronic viral infection, you don't yet have an autoimmune disease, please read that book. It's called The Ozone Miracle, and it'll tell you all about how you can get rid of these problems with ozone therapy, some of which you can do at home on yourself. I talk about that in the book. And other therapies, you're probably going to need to see a doctor who is versed in ozone therapy to treat you in his office with intravenous ozone therapy. And you can find doctors that have been trained in this by going to the American Academy of Ozone Therapy website, which is aaot.us, and you can find a list of practitioners in there. If you're battling with a chronic viral infection, or chronic infection of any kind, actually, it could be bacterial, whatever, ozone therapy will be instrumental in knocking that out. So go ahead and check out that website, aaot.us, and find a doctor that can help you. Okay, so thanks for listening. This is kind of the basics on how to take care of that TH1, TH2 balance, and make sure that your balance is skewed towards TH1 and not skewed towards TH2, and that you're not doing anything that's going to get you exposed to excessive levels of TH2, because you're just not going to get over your autoimmune disease if that's what's going on. Okay, so thanks for listening. If you want to know more, please leave a comment on my bio and forward this information, as always, to anybody it might be a help to. Okay, thanks.